Hi, everyone. Last talk of the day, I think. It's been fascinating hearing about all the different aspects of long COVID today. So, I am Sindhu Mohandas. I am a pediatric infectious disease physician and director of the long COVID clinic at Children's Hospital, Los Angeles. So, this is quite a brief presentation, but I'm going to be talking about sex differences and symptom burden over time in children. No disclosures. So background, I think we've heard a lot, so I'll be quick with this. We know that long COVID is a long-term consequence after acute SARS-CoV-2 infection, and it affects both adults and children. And there are multiple reports and discussions today as well related to prevalence in children, and there is a significant burden of long COVID in children. And the lack of a precise definition definitely makes it difficult to diagnose. So we know that long COVID may present with a variety of physical, cognitive, and mood symptoms. And it describes a range of ongoing, relapsing, or new symptoms that continue or develop after acute COVID-19 and are not explained by an alternative diagnosis. We use the 4 weeks definition for this work. Symptoms can last from weeks to months and can fluctuate over time and significantly affect the quality of life. And in most cases, the prognosis is good, but some may develop persistent long-term symptoms. So the spectrum of long COVID, again, as we heard today, is very diverse and can affect every organ system in the body, including neurological, mental health and behavioral changes, constitutional, respiratory, ENT changes that we heard about. And I think we had this figure earlier in the day, but this is the second half of the figure just to show that how many of the organ systems are affected. So really no organ system seems to be spared from the effects of long COVID. So I just wanted to go a little bit into how the long COVID recovery care clinic started in Children's Los Angeles. So we were hearing about and really, this was at a time when the discussion was, is long COVID even a thing in children? So there were not really resources out there for long COVID, and we were getting more and more referrals to the hospital and reaching out to us about these long-term symptoms after COVID infection. So that's when we started our long COVID recovery care clinic, and this was really one of the first clinics, pediatric long COVID clinics. So we didn't have a lot to go by in terms of other clinics and how they function. So this is how we structured it. This is housed in the infectious disease division, and the ID physician sees the patient for a first visit, which includes a comprehensive evaluation, history, physical exam, and labs if any are needed. And the referrals from there on are based on symptomatology. And how we worked is we had past champions in the various divisions who served as our point of contact and facilitated referrals. This is a pictorial representation of how we function and how our long COVID recovery care clinic functions. So in addition to referrals to many of the subspecialties, there was also pain, social work, mental health, PT, and OT involved in the referrals. So this is one structure of a long COVID clinic, but I also know now there are more pediatric long COVID clinics in the country, and if anyone is thinking of starting a pediatric or any long COVID clinic, I would suggest that having a more in real time, a multidisciplinary clinic would definitely be more helpful. So having multiple specialists in the same place to see the patient at the same time. I know some places have this model and it works well. By the time the patients come to see us, they have pretty much a lot of fatigue, having seen multiple medical providers. So whatever can be done to make their life easier and to be able to see multiple specialists at a time would be the best approach, in my opinion. So what's known about long COVID, specifically related to children? So these were some questions that we thought about, and some studies have evaluated long COVID in children, but there's not enough data compared to adults about its course, symptom burden, and changes over time. And long COVID, as we heard again, multiple presenters in the day, is more frequently seen in adult females. However, there's not much published data about gender differences in children. So our objectives were to identify the symptoms of long COVID in children by gender and to determine the overall duration and course by addressing symptom burden over time. So we included all children referred to the COVID recovery clinic aged between 0 to 21 years, and the study period was between August 2021 to May 2023. And we did a retrospective chart review and also prospective clinic follow-up visits were performed. Data was abstracted using a standardized tool and analyzed with SPSS 28. So this is some of the most common symptomatology we saw. 105 patients were included in this analysis, and the mean age was 13 years with a standard deviation of 3.9. 55 of our patients, so that's 52%, were males. So we didn't really see a big difference between the male-female as seen in adults. The mean duration of symptoms at presentation was 28.2 weeks. So that's a fairly long duration of symptoms before the patients were eventually seen at the clinic. And the most commonly reported symptoms were fatigue, headache, exercise intolerance, dizziness, and brain fog. We next looked at the duration, symptom duration between males and females, but found no significant difference in the symptom duration in males versus females. But some specific symptoms were seen more commonly in females. And these were exercise intolerance, palpitation, POTS, dizziness, chest pain, and brain fog. This was seen more commonly in females. And loss of appetite was a symptom that we saw more commonly in males. But again, the number for the loss of appetite was very low, so the confidence in this difference is not as much. The other thing we wanted to do is look at symptom burden over time. So if you look at this chart, really each line represents a patient and their course. And it depending on how often they followed up with us, these are the time points we have. This is not an excellent comparison because patients come to the clinic at different times and have follow-up at different times. So this is our best effort to put together all the information we have. So the follow-up data we have is only representative of 74 patients who had at least one follow-up. So if you see the red line, it's an average, which shows that overall the symptoms reduce with time. Though there is, eventually in some patients, the symptoms plateau and persist. The blue line on that is the time that they were seen in our clinic and extrapolated to kind of symptoms that were present before presentation. The other thing we wanted to look is at the average symptom burden. And if you see the average symptom burden 9 months prior, so again, and just to explain this chart, the blue line is when we saw them in the clinic, and patients had different times of symptomatology before even being seen in the clinic. So 9 months prior to presentation, the mean symptom burden was 8.4. And as time progressed, so 9 months to 3 months after, that would be 12 months, we see that the mean symptom burden had decreased to 3. And again, the symptom burden remained around this range. 3 plus to 6 months was mean symptom burden of 3.9, and greater than 9 months was 3.2. Again, it's important to remember that these were different patients and not the same patients that were followed. But this gives us an idea that the overall symptom burden does decrease with time. And on looking at this data, there was a kind of sense that if most of the patient's symptoms improved within the first 6 months period, and another large chunk within the first 12 months. But if symptoms were persisting beyond the 12 months, it was more likely that these symptoms continued to be present. So to conclude, adolescents were the most affected age group in our clinic cohort. Fatigue, headache, brain fog, dizziness, and exercise intolerance were the most predominant symptoms. And symptoms like brain fog, chest pain, palpitations, and POTS were more commonly reported in females. And a decrease in the burden of symptoms was noted over time. We definitely need, we recognize that this is a self-selected group of patients, and definitely there's some bias. It's not a population study. So larger studies and longer prospective follow-ups are needed to best quantify and characterize the symptom burden and duration of pediatric long COVID. Thank you.